Dedhia. Just let me give you a short formal introduction about ma'am. She is a practicing obstetrician and a gynecologist. She specializes in the management of high-risk pregnancies, laparoscopic surgeries and infertility. She is a consultant at the Sunflower Hospital, Juhu, and Criticare Hospital, Juhu. She has also received a recognition award from the Federation of Obstetrician and Gynecology Society of India in the year 2002. Ma'am, I invite you to come and continue the session, please.
Thank you for the lovely introduction. Good afternoon to everybody. Today I'm going to speak on the normal problems that all the women go through. Childhood is a very, very lovely phase. First slide. Okay. The second phase is the teenage. That's the time when we mothers start realizing that my little child is becoming a woman. She starts having her periods. Breast starts growing. There are not only physical problems, irregular periods. There are girls who are blessed. They get regular periods, we don't have a problem, we don't see a doctor, everybody is happy. But then there are physical problems, there are social problems. She's growing, she has to be careful. There are lots of problems that are associated with this, and how today's generation is growing is very different than what we have grown and perceived. Mother will not allow you to go out of the house after 8 o'clock. She will not allow you to see certain movies. Today we see television. All the children are exposed to everything in the beginning. We as children got periods at 13 years, 12 years. Today's girls get their period earlier, 9 years, 10 years. And it's too much for a mother to handle. You understand? She's still a child. She doesn't know how to take care of herself. Today in school, we have education for children, telling them that these are private parts. They are not supposed to be touched by anybody. Sexual abuse in young children, there are so many things that start troubling you. The child is small, she doesn't know all this. Whether I tell her, whether I not tell her. So, all these problems start at this point. Today I'm going to be talking more about the medical problems and how to deal with them. Basically, when a girl starts getting her period, that just means that her ovaries have started functioning. The ovary produces an egg every month. If the egg comes out in time, then her periods are going to be regular. But even in spite of getting regular periods, there are a lot of girls who have pain during periods. And this pain is because all the blood and the endometrium, I'm going to show you a diagram. You see, that's the uterus and the blood flowing out through the mouth of the uterus. I'll just show it to you. Huh? Okay. Okay. See, that's the cervix, okay? This is a very thin area of the uterus. Very, very thin, fine, pinpoint area. All the blood comes out through this opening. So the uterus tries to help, it contracts. When it contracts, you experience pain. The pain is usually felt on the first day of the period, maybe just 1 day previous. Now all this is considered as normal, but my child has her exams and if she has pain, she's not going to study, she's going to rest. I feel in today's day and age, where medicines are available, okay? There are mothers who give sake to the girl, or she'll give Raj Bindu, these are the homely things that are given. But in spite of which, if the girl is still uncomfortable, her daily routine has to be done, we give her antispasmodics, which are good medicines. Now the problem comes when the pain does not go away with antispasmodics too. That is the time you show the doctor. Otherwise, giving an antispasmodic to your child does not have any harm. I'm so sure Bhavisha is smiling here. She also has some medicines which we give to children so that the pain is not there. The pain happens because of a hormone called prostaglandin. Okay, so she will give medicines to control that. And I would give medicines just to control the contractions. There is a very dirty disease called as endometriosis. Okay, I'm going to talk about that because we should know when to approach a doctor in pain. Everybody gets pain. If you talk to the elders, wo to sabko hota hai. We don't do anything for that. But if the pain becomes bad, such that our child cannot attend college, she can't attend an exam, or she can't do her routine, then treatment is very important. The only thing I would, as a doctor, want to rule out is the disease which I just spoke of. I'll just go to endometriosis first. In endometriosis, what happens is the blood flows in the opposite direction. Means inside the uterus, it flows through the tubes and enters the abdomen. Then the endometrium starts growing there. Okay, means every time the girl has a period, the bleeding happens inside. Sometimes the bleeding happens in the ovaries, the blood keeps on collecting there, and it's called as a chocolate cyst. That is already collected blood, so it has to be operated and removed. And then we keep such girls on low dose hormones so that she doesn't have a recurrence, because once she has it, she can keep on having it. Okay? Usually we don't see this very early in the disease. In the early disease, the sonography looks completely normal. So everybody is happy, but the pain keeps on coming. So once we start on medical treatment, this thing does not get aggravated. It also leads to infertility. So when somebody has a lot of pain at a particular age, after 10 years when she wants to have a child, it is difficult. So we always want to rule it out. So when anybody comes with pain, the only thing we are interested in is giving them painkillers. If the painkillers it goes away, I know that it's not endometriosis, because endometriosis does not respond to any kind of painkiller. Okay? Today I would take opportunity even to speak about cervical cancer vaccine. I'm so sure everybody has heard about it. I'm going to tell you what a cervix is and how does the vaccine prevent an infection. Cervix is this mouth of the uterus. Okay, this whole thing is the uterus. This is the body of the uterus, which expands when the baby grows inside the uterus. The mouth of the uterus is the elastic band which does not allow the baby to come out till the baby is ready to come out. So when the labor pains start, that is the time when the cervix starts opening, and it's a very, very painful procedure, and that's why labor is so bad. So when the mouth opens completely, then the baby comes out. So this is an elastic band. It's a very, very important organ of our body. Malignancy can happen in any part of the body. There are two malignancies today I will specifically talk about. One is cancer of the breast, and the second is cancer of the mouth of the uterus. Cancer can happen in the ovaries also. Cancer can happen inside the lining of the uterus, which falls every month. But cancer of the lining of the uterus is a good cancer. Why? Because it shows itself n number of times before spreading. So I have enough time to treat it. Anything that spreads before it shows itself is a dangerous thing. So, in our country what we do is pap smears. Pap smears are smears taken from the mouth of the uterus. We put it on a slide, we send it to the lab. Pap smear never shows cancer. It shows precancerous conditions. If it's cancer, I can see it, then I would want to do a biopsy. I will not do a pap smear. Okay? So I will first find out if this patient is prone or no in all the women which I see today. Now, cancer of the cervix, one of the most important causes is a virus called as the HPV virus. Like, I'll just give you an example to make you understand. If I have AIDS, HIV, if I'm HIV positive, I don't know about it. Because I don't have any problems. I'm very comfortable. The HIV progresses, and one fine day I will realize that I'm having diarrhea, I'm falling sick very often, and I go to a doctor and he asks me to do all the thyroid tests just to find out why my immunity is so low. And then he realized that I have HIV, and that's the time I come to know. So I carry it for a very long time before I find out that I have it. Similarly, HPV virus is just like that. It does not give you symptoms. You are a carrier, it's a sexually transmitted disease. You are a carrier for a very long time before you show it. So the only treatment is that I don't get the virus. And how do I not get it? Before sexual activity, this vaccine is available. So we give it to our daughters so that they never suffer from HPV. I don't need to take it because I've already finished childbearing. I have one partner, I'm comfortable, he doesn't have, I don't have it. Or if I already have it, there's nothing I can do about it. So we only give it to young girls before sexual activity. There are 3 doses which are given, and it covers the immunity lifelong. So that's cervix, and the second thing is cancer of the breast. That now, by the time somebody gets a feeling of the nodule or pain in the breast and realizes that they have a lump, and when they go to the doctor will check for lymph nodes. If the size is very big, lymph nodes are already involved, there's nothing much we can do. They will probably remove the breast, remove the lymph nodes, and start on chemo. Okay? So ideally, I don't want to go on that road. So what do? I do a mammography every year after the age of 38, just to be sure that I am fine and I'm not going to suffer again. If there is something which is found, it's very easy, local removal helps. I don't have to remove the whole breast. Now there is whenever we talk about preventive medicine, usually surgery is not involved. But there are people who have very, very strong family history of breast cancer. So there's a branch called genealogy where they check for genes which can lead to breast cancer in a person. There are people who, because of such strong histories, and if they are positive in the gene, they get their breast removed prophylactically. This is not medically indicated, but there are people who do it because they've seen the horrors. Okay? You cannot have a vaccine for any cancer. You can have vaccines only for infections. So the only way we can help ourselves is this. The third cancer I was talking about is endometriotic cancer, which is a good kind. So there's not much we can do about it. We are very happy if somebody has it because there's treatment. The patient is first very sad that, oh God, I have cancer, but then is very happy, doctor, you treated me, and 10 years back I got operated, I'm still healthy, I have no recurrence. Everybody is happy, but everybody knows that it's a very mild kind, moderate kind. Ovarian cancers just suddenly come out of the blue. For that, we do a sonography once a year. Okay? Now, this is just a diagram which tells us the anatomy. This is the ovary. We have 2 ovaries, 2 tubes. Okay? The tubes are the only for transmission of the egg from the ovary to the uterus. You see the small diagram below. We are all born with n number of eggs. Men produce millions and millions of sperms every day. Every day. When we check a person for infertility, we check the male partner also. What we tell them to do is a semen analysis. If they have less than 20 million sperms, it's very difficult for them to conceive. We have to give them medications to increase their count. A woman, very precious. Just imagine how precious these. We are all born with so many eggs only, and every month 1 egg is only formed. Okay? For some reason, there are some bad accidents, like a woman develops a cyst and there's a torsion of the ovary and there's a gangrene, and sometimes 1 ovary is removed, or it's removed because of some dermoid or some tumor, and there is only 1 ovary left. A woman can still produce lots of babies. Nothing goes wrong. Okay? So, there is something called as ectopic pregnancy, which I just want you to know about it. Because when we see patients who have ectopic pregnancy, they've never heard of it. Okay? You never have infection in the uterus usually. But when some people put in copities, or some people have had medical termination of pregnancies where the infection has not been covered with, then sometimes you can have blockages of the tubes. The third commonest cause is endometriosis, which I just told you about. Endometriosis can just block the tube or partially block the tube. Tuberculosis in our country also can come from somewhere else. I got chest TB and ended up with an infection even in the uterus. In that case also the tubes either gets partially or completely blocked. Sometimes the pregnancy does not reach the uterus, it stays in the tube only. So by the time she's 2.5 months, the pregnancy starts growing. It does not realize whether it's in the tube or the uterus. It grows. When it grows, sometimes this thin wall ruptures, the bleeding starts. Bleeding starts internally. So outside she's comfortable, she starts getting a severe pain, and suddenly she faints because the hemoglobin is going down. She's just bleeding massively inside the abdominal cavity. Okay, in today's day and age, we use laparoscopy. We enter we first do a pregnancy test, a sonography, which shows that she has pregnancy outside the uterus, which is bleeding. We put in a laparoscope, stop the bleeding, remove the blood, give her blood if it's required, and then anybody who has one ectopic can develop another ectopic again. Now what happens is the husband is working, she's taking care of the kid. Suddenly in the middle of the day she is fainted and nobody's in the house. By the time somebody realizes that she's pregnant and bleeding inside, it's too late. So sometimes we see very, very bad patients, and this is a very preventable cause, very, very preventable cause. If somebody misses a period, we usually see the heartbeat in the 6th week. So if I don't see something in the uterus, then I start suspecting. That's a good time to treat an ectopic. I don't have to give her blood, and it's a very simple procedure. But in a ruptured, sometimes we give 6 and 7 bloods, and then she develops infection. There's something called as a DIC, where she loses a lot of clotting factors. And then she ends up in the ICU, and then it's, a young woman, everything in the house depends on her. The cooking, the child, the husband. So when she's sick, the amount of pressure a doctor gets now, when will she get better? When will she be able to do everything? How long will I require help? How long will I have to, take an off? It's really very difficult. In the first child, when we see deliveries, everybody is very, very happy. And the mother is also very ecstatic. Second, third day, you go to see her. The child is not allowed her to sleep. She doesn't remember when she slept properly. Her body is hurting, back is hurting, stitches are hurting. And everybody is telling, milk is coming, milk is not coming. You're not holding the baby right. This is what you're supposed to do. Cover your head, put cotton in your ears, wear chappals, wear sweater. It's already hot. Don't give her the sweater. We are living in today's day and age when antibiotics are given, painkillers are given. Let her sleep when the child goes to sleep. Let her feed the child when the child gets up, and let her sleep again. She requires that rest. Get up in the morning. You have to eat 5 times in the day. You are feeding the child. They pour ghee in everything she eats. She delivered when she was 70. Post-delivery, she becomes 66, 65. And after 3 months when I see her, she is 87. And then she'll ask me, when can I start walking? When can I go to the gym? How will you leave the baby and go to the gym? You have to make time, but don't overeat. Don't eat ghee, badam, pista, just because you think by taking that, the baby is going to become fat. She will put on weight, but baby will be the same. It's easy to make a patient understand. But to tell her relatives who have lived with this, in those days, women used to deliver at home, which was a second life for them. Okay? She would have lots of vaginal tears because there's no one cut given. When the baby's head comes out, it tears everything and comes out. She has bled a lot, so her extremities are cold. When you lose blood, your extremities become very cold. You are prone to infection. So you are kept in a room, there is a heat which is kept below because that kind of takes care of the pain, keeps your extremities warm. And that time when you give such woman more food and things that she likes, that's understandable. And everything that our ancestors tell us have some scientific meaning behind it. The laddus they give, which has bone, methi, copra, all that increases milk production. And that is good. So I tell them you take that. But don't overdo things. Now you have to think and proceed. Okay? And that's all I wanted to speak about pregnancy. Contraception I want to speak about because there are a lot of newer things coming. This is how the uterus is placed inside the body. Okay, I'll just show you this diagram. This is the uterus. Okay, in the cut section. Cut section means it's like this, how it's seen. Okay, that's the ovary. The other ovary is on this side. This is the urine bag. Whenever a woman gets pregnant, this uterus starts becoming big. So the first thing it presses on the bladder. So such women keep on wanting to pass urine again and again. Supposing similarly, if somebody, I am very sure everybody's heard about a fibroid. Okay? When anybody develops a fibroid, if it's on the anterior wall of the uterus, means on the ageka wall of the uterus, it presses on this. So even if she doesn't have any symptoms, she'll keep on complaining, doctor, I have to go to pass urine again and again. If I sleep on my tummy, then I have to go and pass urine then and there. So that is a very, very common symptom. There are girls who have the uterus positioned backwards like this. They have a lot of pain. Lot of pain. In the olden days, they used to correct by operating that this is a wrong position. Now we don't. Like how everybody's nose position, shape is different. Somebody has round noses, somebody has pointed nose. Similarly, the uterus can be aage, piche, or in the center. Does not affect. And that is the stool area. There's one more diagram I've given that I want women to understand the anatomy of the external area. See, this is the vagina. This is from where we pass stools. This is the urethra. Urethra is covered with these two small folds, which is called as the labia minora. Now, God has given them on purpose because these two folds cover the urethra. Okay, I have a lot of women who have this excessive need of keeping this area clean. What a